Good afternoon, everyone. Welcome to the July 24th, 2025 Jefferson County Health Department Board of Trustees meeting. We are in our new building, so I'd like to ask that everybody please have patience as we go through and work to get everything ironed out online. If something happens, and there's the potential for it, because again, this is a new process for us, a new building, we may have difficulties. We apologize in advance, but we will work on those and getting those taken care of. Everybody here, if you would please mute your phones so we don't have any interruptions as we go along. The agenda appears to be light, and we will now call the meeting to order. Ms. Pinkley, would you do a roll call, please?
Mr. Pigg?
I am here.
Dr. Henry?
Here.
Ms. Stidham?
Here.
Mr. Deal?
Here.
Ms. Taylor?
Here.
We have established a quorum. Ms. Henry, would you please read the mission, vision, and purpose?
Sure. Mission is to promote positive health outcomes through delivery of foundational public health services. The vision is a healthy Jefferson County. And the purpose of the health center, the JCHD is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Okay, thank you. So next on the agenda is the approval of the agenda. If we could, or an amendment, if somebody would like to make a motion to approve or amend.
Make a motion to accept the agenda as presented.
I'll second.
We have a first and second. Is there any discussion on the matter? Not hearing any. All in favor, please say aye. Aye. Any opposed? Motion carries. We have no guest in the room as of yet. It could change, of course. So the next is the approval of the June 26, 2025 meeting minutes. Do we have a motion?
I make a motion to approve the June 26, 2025 minutes.
I'll second.
First and second. Is there any discussion on the matter? Not hearing any. All in favor, please say aye. Aye. Any opposed? Motion carries. Approval of the June 2025 expenditures for $62,958.16. Do I
Make
have,
a motion to approve.
thank you. Do I have a second?
Second.
Having a first and second, is there any discussion on the matter? Not hearing any. All in favor, please say aye. Aye. Any opposed? Motion carries. Next is the approval of the June 2025 electronic payments for $510,656.64. Do I have a motion?
Can you repeat that again? Did you say?
Did I say the wrong numbers?
I think so.
Well, I wrote it down. I may have wrote it down wrong. 510, 656,
54 cents.
54. Is 54?
Yeah.
I apologize for that mistake. 54. Thank you for correcting.
Mr. Chair, can you speak in the mics a little bit more? I think you're not hearing.
I had to get my microphones.
I make a motion to approve.
For the corrected amount. Okay. So once again, so I have a first and a second. Is there any discussion on it? I will repeat the corrected amount. It's for $510,656.54. So we have first and second. Not hearing any discussion. All in favor, please say aye. Aye. Any opposed? Motion carries. Next is pre-approval for the August 2025 electronic payments for $649,321 and no pennies. Do I have a motion?
I make a motion to approve.
I'll second.
I have a first and a second. Is there any discussion on the matter? Not hearing any. All in favor, please say aye. Aye. Any opposed? Motion carries. Public Health Report, Director's Report, Mr. Sykes.
Okay. I'll start out with grants and contracts. Really, we don't have any updates from our last meeting. We are seeing some funding trickle through, but not at full amounts. So not a whole lot of new information there. I want to let the board know as well as our environmental group They are reviewing the cost reimbursement charges. We wanted to see determine if we need to increase those rates. These are the charges like the food and beverage permits. They've not been adjusted from what we can determine, I think, since 2018. So we're going to be reviewing those just to see if anything needs to be adjusted on that. Once we do that, I will bring that to, or report it to the board. I don't believe it needs approval. I talked to Christie. It's way that it's written into the regulations, but I will advise the board of those before we implement it. And those will be for 2026, which we send the billing out for that in October, I think, is when we start sending that out to facilities. Also, I wanted to report that we had no significant changes to the 2025 budget for the second quarter, so no revision was needed, and therefore the board, we don't need to do an approval of any updates. You know, that's a requirement that we would do if we changed the budget anyway. We would bring it forth to the board to get approval, but there were no revisions needed. Next is our old facility, since we are now in our new location. Our plan is to begin selling the furniture that is in that building through our Gov Deals site. So we'll be working on that, coming up with a plan on the best way of doing it. I've talked to different people. A lot of them feel that a building will sell better without furniture, especially with the age of the furniture that we have over there. So that's going to be our next project. We've been talking on that already. And then at some point, we need to discuss the sale of that building, if we're going to sell it, or what the future of that building is. We've had some inquiries from the public on that building, so we'll just have to have a discussion at some point on the future of that. We're still working on scheduling our medical director to attend our September board meeting. So I just want to remind board members, if you do have something, a topic or some questions, if you could get those to me before August board meeting, so I can get those to him and get that all set up. I added one thing because it came up this morning. With the heat that we are having, we are a cooling site. We've always been a cooling site, both locations, a cooling center. So I thought I'd put that out there since we are streaming live. If someone knows of someone in need that needs to come in and just cool off, they can sit in the building. We have bottled water, or we have water fountains that they can use. So I just wanted to put that out there. That's our Arnold and this location, our cooling centers during the day. And that's my report.
Are there any questions from the board to Steve? I do want to point out that I know, Kirsten, I believe you put the building information together with the payments and stuff. I really liked that spreadsheet. I suppose you did that. It was very helpful. I really liked that. Thank you. Next would be, is there any questions or comments about the program reports that are in the actual document of information that we received? Nobody has any questions or comments within there? You do? Yes, yes,
Just
yes, ma'am.
ask Steve, is there a date for opening house still not set, or?
I was gonna get to that, but, all right.
Yeah, that, September 17th is the date. I'm making sure. September 17th, we plan on having a dedication, or ribbon cutting and dedication, starting around 11 or 12 noon, at noon. And then we'll do an open house after that, the rest of the afternoon, where anyone from the public can come in and go through our facility. We'll have set up where they can talk about different programs. They can even go back into the clinic area, because we will not do clinic that afternoon in this location. So we'll have the vans set up, just give a kind of an overview of everything, that all of our programs. that afternoon.
Okay.
So September 17th.
All right. Thank you, sir. So there are no public comments because there's no way from the public here at this point. Old business, of course, I guess new building updates we're in. So what else would you like to say about nothing? All right.
So, yeah, we're fully in, and I want to tell you, the move, I think, was about as successful as it could have been. And I think a lot of that has to do with pre-planning, and a lot of that goes towards Mr. Crawford. He spent a lot of time working with the moving company and putting in a system of how we're going to coordinate this, and our managers took that, went to the staff, and it was, I didn't know we were going to make it or not, but come that Monday, they had everything pretty much moved in 4 to 5 hours into this building. And then they did a second move of some larger equipment. But it was pretty best move I've ever been involved with, so I'll tell you that. Of course, I didn't have to lift any boxes. But I really do appreciate the staff and the work that they put in. And again, Steve and the managers. Our IT system, we didn't have a whole lot of glitches. We were operating, we were crossing our fingers on vital records, but that worked. I think it went down one time and we got it back up. So thanks to Steve and Chrissy. Chrissy had to do a lot of things as well during that time. And our third-party vendor, CMIT, was also extremely, they had a person on staff in our facility during that time. You know, as in any new facility, we're still working on a few things. The contractor, we have some door adjustments here and there. So there are some things that we're fine-tuning with the new building, and they are coming in and fixing those. We're getting trained on the facility. It's a little bit different than light switches flipping on and off. This is all LED, motion sensors and all of this. So we actually got trained on how the lights work. We've had training on the HVAC, which we'll probably have to have more training on. Just a lot of, the irrigation system that we have, all this we're being trained on and learning how the building works and how it functions. I didn't have an update on the architect. They didn't send me a bill yet. I think we still owe them some. And then again, Kristen always provides, and I put in my report where we're at with our building payments, and that's in the report as well. But I think we had a pretty successful move, and I think we're glad. We are glad. I'm not going to say I think. I know we're glad to be in it. Appreciate the board's support on this.
All right. Any questions? All right, not hearing any, we'll go on to new business, and we only have really the application of entertaining any topics for the next agenda. Does anybody have any topics they would like to put on for the next agenda? Going once, twice, three, not hearing any, we'll move on to closed session. Do we have, okay, we don't have a need for any closed session, I guess all that. So the next on the agenda is an adjournment for anybody who'd like to make the motion.
I'll make a motion to adjourn. Second.
I have a first and second. Any discussion on the matter? Not hearing any. All in favor, please say aye. Aye. All right. Nobody's going to object. Very good. Motion carries. Thank you, folks.